Hey guys, it's Mrs. Ballot again. We are back for the last lesson of Chapter 7. It's the fourth lesson. Today we have 3 objectives. We need to know the difference between medical and surgical asepsis. Yesterday we went into detail with medical asepsis, and we talked about all the different methods that we use for medical asepsis, including sanitization, antisepsis, disinfection, and sterilization. The second objective for today is you need to know what PP is and what we use it for. And last but not least, you need to familiarize yourself with different types of transmission-based precautions, specifically droplet, contact, and airborne precautions. So today we're starting with surgical asepsis. Surgical asepsis is something that we use anytime that we have to put something in somebody's body. We talked a little bit about how we clean the equipment yesterday when we sterilize it, and we need to use sterilized equipment. But when we are using that type of equipment, and there's certain procedures that we follow, called surgical asepsis, to make sure that we are not by chance introducing any type of microorganism into someone's body. So when we're giving injections and we're using an IV, you want to make sure that you are not introducing pathogens. So like you guys have probably seen on Grey's Anatomy or I don't know, other medical shows that you might have seen where they enter the operating room and they have their hands up and they're not touching anything and they use special kinds of gloves. All of that stuff is real to the point, depending on what show you watch, but we do things like that at least. And those techniques are called surgical asepsis. One of the other ways that we maintain infections or prevent them from spreading is we use barrier methods. Specifically, we use personal protective equipment, or PPE. We use gloves, gowns, masks, and eyewear to protect ourselves from becoming infected. So gloves are the most commonly used barrier method. Think about all the things that we would wear gloves with. Believe it or not, a long time ago, they didn't wear gloves. They didn't understand how germs were spread. And I'm not saying a long time ago, like 100 years. I'm saying in the early 80s or 70s even, mid 80s. They didn't wear gloves like we wear gloves now. They just, they would do things that you wouldn't even think of doing now without gloves. So they are quite common now. But you want to wear gloves anytime that you have the potential of touching or coming in contact with blood or body fluids, as a way to making sure that you don't touch any kind of substance that might have a virus or other microorganism in it. You need to use gloves when you're performing certain types of care. So for instance, when you're helping somebody go to the bathroom, or you're cleaning them up after they've gone to the bathroom, or anything like that. If you have a cut on your hands, you may want to consider using or wearing gloves when even you wouldn't normally, just as a way to prevent and cover so that any type of microorganism can't get in. When you're shaving a patient, in case you nick them and they start bleeding, or you're brushing someone's teeth, or basically if you come in contact with body fluids, you need to wear gloves. When you wear gloves, they need to be intact and they need to fit properly. Keep in mind that when you're wearing gloves, it's not to protect your patients. When you wear gloves, it's to protect yourself. It's to protect your family so that you don't take anything home to them either. So wearing gloves, a lot of people think it's to protect patients, but that is actually not the case. It is to protect yourself. Another thing that we wear sometimes to protect ourselves are gowns. They can be made of paper or they can be made of fabric. But anytime that you have the potential of being splashed or somehow getting blood or body fluids on your clothes, you don't want someone's blood on your clothes. You don't want someone's vomit or any other kind of body fluid to be on your clothes. Because first of all, you're not going to want to wear that around all day. Secondly, you don't want to take it to another patient. Third, you don't want to take it home to your family. So if you have the potential of getting something on your clothes, you need to wear a gown. Not typically, the gowns are only worn once. Once you wear them, if they are reusable, we put them in the linen hamper to be washed. If they're disposable, we throw them away. And the next time we need it, we get a new one. At any point in time, whether you just put it on or not, if a gown becomes wet, it is considered contaminated. You need to get it off and you need to replace it and get a different gown. The third type of barrier method that we use are masks. Again, these are to protect us, these are to protect ourselves, not to protect our patients. However, if you have a cold or something, you may be asked to wear a mask to protect your patients. But anytime that you have a chance of breathing in any type of substance or body fluid, or come in contact with somebody whose saliva could have a pathogen in it, you're going to wear a mask. Typically, we use surgical masks, like the ones that they use in surgery, the little blue ones that we have. But depending on what illnesses they may have, you may have to wear a special kind of mask called an N95 or a popper system. When you wear your masks, you only wear them once, and then you throw them away. The next time you need one, you get a new one. The last barrier method that we have to protect ourselves is protective eyewear. So whether it be goggles or a face mask, it all depends, whatever the situation you're in. I wear glasses, so typically if I need a protective eyewear, I would get goggles and put over top where they would kind of like cover my glasses. Some people who perform surgery or help in surgery, they have masks that have face shields that come up over them to protect them that way. So there's different methods of eyewear protection that we have, but anytime that you could be splashed or you might get something in your face or in your eyes, you need to wear protective eyewear to make sure that you don't have that happen. Trust me, you don't want that to happen. So those are all the different types of barrier methods that we use. The last thing that we're going to talk about here in Chapter 7 are transmission-based precautions. These are methods that, based on someone's illness and how it is spread, we wear personal protective equipment to protect ourselves and our other patients to make sure that we don't take their illnesses and spread them around and transmit them to somebody else or ourselves. Now, before we talk about them, we need to talk about standard precautions. This is a term we used to call universal precautions, but this is a term that we use basically by treating every single person, every single patient that we take care of, that they could have some kind of bloodborne pathogen or a pathogen that we could get. And so when we come in contact with blood or body fluid, if we might touch it, we wear gloves. If we might get splashed, that we would wear a gown and we would wear goggles or a mask, things like that. So we use it for everybody. Those are standard precautions. When, on the other hand, we treat somebody, I don't want to say differently, but we take special precautions based on how their diseases are spread. We sometimes call that isolation or transmission-based precautions, and there's 3 types. The first of which are airborne precautions. These are precautions that we take for people that have very contagious diseases that you can get just by being in the same room with somebody. And they are very specific, very contagious types of diseases. When somebody is put on airborne precautions, it means, first of all, that they need a special room. Their room has a double door system, and both doors are never allowed to be open at the same time. When you enter, you have to wear a gown, you have to wear a mask, and not just any mask. You have to wear a special kind of mask, one of those N95 that you have to be fitted for, or a popper system, which is like this kind of spacesuit looking kind of system that you have to wear that has a filter on it. You have to wear a gown, gloves to go into the room. And not only you, but anyone who enters that room. So whether it's the patient's husband or wife or mother or daughter, if somebody's on airborne precautions, anyone who goes in that room has to wear this. We try to keep the person in the room as much as possible. If that person definitely has to come out, we can't take something to them, maybe for an MRI or something like that, then they have to wear a mask in order to prevent that pathogen from being spread to other people. Their special room has a filtering system that the air does not circulate out to the hallway. It gets sucked up in through the ceiling, gets run through a special kind of filter, and then taken to the outside versus being circulated in and around the hallways, the hospital, and that kind of thing. Diseases that are put on these kinds of precautions would include tuberculosis. It might include measles. It could include Ebola. But those are some of the airborne type of precautions that we take. The kind of next step down from that would be droplet precautions. When somebody can spread an illness from talking, speaking, sneezing, basically breathing within 3 feet of somebody and spread a disease, then those are droplet precautions. So the flu, trying to think of another one, definitely the flu, chicken pox, things like that, that just being within 3 feet of them, and like the particles from their saliva from speaking and coughing and all that good stuff, like it could land on the bedside table, and if you touch it and come in contact with it, you could get it. So anytime that you have somebody with a disease like that, we put them on droplet precautions, and anyone who enters the room needs to wear a gown, they need to wear a mask, and they need to wear gloves. And again, anyone who enters the room, not just the healthcare workers, but visitors and everybody. The last type of precautions that you might see are contact precautions. These are precautions that we take when you can get an illness just by touching something or someone. So we wear a gown just in case we don't touch, so we don't get anything on our clothes, and we wear gloves. You don't need a mask because you don't inhale the illness or anything like that. This would be things like MRSA, where just by touching it you could get it, or you could pass it on to somebody. So those are the 3 types of transmission-based precautions: airborne, droplet, and contact. Now, if you touch something and it's contaminated, one of your vocab words is fomite, and that is basically a non-living object that can transmit a disease. So for instance, when somebody with contact precautions, if you touch maybe a writing utensil or an eating utensil, a fork, something like that, that the person has touched, and you touch it and you can get a disorder or an illness from that, that would be considered a fomite. Another vocab word that your book talked about that we didn't really mention in any of the lectures was a vector. That is a living object that can pass on an illness. So for instance, in the disease like malaria, where a mosquito bites somebody and then transfers it to the next person that they bite, that would be considered a vector. So be familiar with fomite and vector as well. believe it or not, that is actually the end of chapter 7. So if you have any questions, please shoot me an email, let me know, and I'll get back to you. Otherwise, tomorrow we're going to get started on chapter 8. We have a couple lessons to do in it, and then we'll be tested on chapter 7 and 8 together. All right, see you tomorrow.